Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Consent and euthanasia. Consent. Consent is a voluntary agreement or compliance or permission. Consent is dealt under the section 13 of Indian Act. Two or more persons are said to be in consent when they agree upon the same thing in the same manner. Section 14 Indian Contract Act states that consent is said to be free and voluntary when it is not obtained by fraud, undue influence, or misrepresentation. So one should give consent only with his own wish, not with others' compliance. Type of consent. In medical practice, we have two main types of consent. One, implied consent. Two, expressed consent. In implied consent, action of the patients are implying or signifying that he is in giving consent. Implied consent is the most common type in practice. Expressed consent. Expressed consent is of two types. Expressed consent can be given either orally or in written way. Any procedure beyond the general physical examination requires an expressed consent. Such expressed consent should always be informed and expressed. Full disclosure to the patient is done. Full disclosure. In full disclosure, each and every aspect of the disease and treatment plan has to be disclosed to the patient. And patient should have to say yes in the treatment. And the patient has a say in the treatment. Exception of full disclosure is doctrine of therapeutic privilege. In doctrine of therapeutic privilege of doctor is to withhold the information of the patient from the patient and for the benefit of the patient is doctrine of therapeutic privilege.
thank you and thank you for watching.